My name is Dr. Shannon Aiello. I'm an owner and audiologist at Columbia Basin Hearing Center, which is in Washington State. And today I'm here on behalf of Virtual Care, and that's care with a K. And we are a group of clinician-centered, created and presented virtual groups for both therapy sessions as well as individual kind of educational purposes. So I'm here representing audiology, which is all things ears. So I'm your ear expert of the group. And this is my first presentation with this group, so I'm excited to be a part of you guys today. But we're going to be talking about a really important topic today, which is hearing loss and dementia. So it's been very interesting the last, I would say 5 years or so, maybe even 5 to 8 years or so. This is something that is getting a lot of attention, both from a marketing perspective as well as a healthcare perspective. So a lot of us, my patients that are over the age of 50 has probably received a postcard in your mailbox talking about hearing loss and dementia and the importance of hearing loss and treating hearing loss, or you might get dementia. And I even have patients coming in that are quite scared actually because they have been to other places and been told, oh yes, you have to get this hearing aid or you're going to have dementia. And so it's something that there's definitely a lot of reality to this topic. I think we all need to know the truth with it, but unfortunately we're seeing a lot of fear-based marketing being spun off of it, used for the purpose of selling hearing aids to people and kind of scaring them into having to get hearing aids. So today you're going to get just the facts from the ear doctor about hearing loss and dementia and kind of what you need to know. So we can start by taking a look at both of those conditions. Now, dementia, I am not an expert in, and they probably have someone wonderful in the group who could do some great presentations for you. But dementia is something we are starting to see a lot more of in our seniors and our aging population. In fact, most of us probably know a friend or a loved one that's been affected by this condition. It's a very hard condition. It is a progressive brain condition that can cause changes in behavior, thinking, actions, emotions, and ultimately is a really difficult condition to deal with, both on a personal standpoint as well as from a healthcare perspective because of that progression of the disease. We do see it in an aging population. So as you get older, there is a higher probability that you are going to develop that condition. Unfortunately, I think there's some genetic components involved with it, but it is something that we are definitely starting to have to deal with more with our aging population. So that's dementia. And then we can talk about hearing loss, which I can talk a long time about, but we'll keep it short and sweet for you guys. So what you need to know about hearing loss. There are over 48 million Americans, so that's Americans alone, with some form of hearing loss. And 96% of hearing loss, this is an interesting one, is actually correctable. So it's to a level that we would be able to help restore more normal hearing and understanding with some kind of hearing technology, whether that's a hearing aid or an implant or an assisted listening device. There's lots of different options out there, but people need to know that the vast majority of hearing losses are correctable and we can get a more normal sound to the brain. Now, sadly, as an industry, even though 96% can be corrected, we only see about 10% of people who are eligible for hearing treatment move forward with it. Now, there's a variety of reasons with that. You know, a lot of people are scared that hearing aids are going to make them look older, which is kind of interesting nowadays that we're wearing the big Bluetooths in our ear and no one pays attention to that. But I will tell you, we do have hearing aids that are invisible now. So that excuse is just off the table. No more of that. They're pretty sleek looking. In fact, I wear some occasionally and no one can tell, even when my hair is pulled up, that I'm wearing hearing devices. So People are worried about that. People are worried about, they are an investment, unfortunately. Insurance typically doesn't cover hearing aids, or if they do, it's a small amount. And realistically, hearing aids for a good set are going to be anywhere between $4,000 and $6,000 for the set. So that's something that we are dealing with, and insurances are getting a little better at trying to help offset that cost. It's interesting though, if you look around the globe at places with a more social medical approach, that they're giving away hearing aids so there's no cost to them. The adoption rate for hearing aids is still about 10%. And so even when people are getting hearing aids for free, we're still seeing about 10% of the people that need them use them. So there's definitely some work we have to do there about getting people excited about treatment. The technology is better than ever. So just because someone might have had something 10 years ago that didn't work doesn't mean that, there's no hope at all. So we'll talk a little more about that later. But hearing loss in general is something that, just like dementia, we do see it kind of progressing with age. So typical studies show us that after the age of 65, the normal American is going to start to lose about 10% of hearing every 10 years. So we do see hearing loss start at that age and start to go down. Once we hit about 80, that accelerates pretty rapidly. So just like dementia, we're seeing in that aging population that hearing loss is something that starts to happen pretty rapidly at that time as well. So let's talk a little more about hearing loss and dementia. 2011 was the big study that kind of brought this to the table. Before then, we didn't know anything about this. We weren't even talking about this. When we discussed hearing loss and treating hearing loss, we were not talking about cognition or health ramifications or anything like that. So 2011, Johns Hopkins University came out with their first study that talked about the correlation between hearing loss and dementia or cognitive decline. And it actually had some pretty startling facts in it. So for example, it found that when compared to their normal hearing peers, people with hearing loss, especially those with untreated hearing loss, had significant more ability to have some cognitive decline. It was actually about 40%, if I remember right. So you have the same age, you have every other factor created. This person has hearing aids or normal hearing. This person has no correction and maybe a moderate loss. And there was a 40% likelihood that the person with hearing loss and no correction had more of a chance to develop dementia or Alzheimer's or have cognitive decline versus their normal hearing peers. So that's a pretty big number. That's not just a little. 40% is a pretty significant finding to support this study. So they found that there was a correlation there, and then they also found that there was a correlation between how much hearing loss you had. And so again, compared to a normal hearing peer, if you had a patient with a more severe loss, the more severe the loss was, the higher likelihood that person was to have cognitive decline or dementia. And so we classify hearing loss into different categories. We have mild to moderate to severe to profound. And then as your hearing declines, you kind of move down those scales. So for example, mild hearing loss sounds pretty similar to having earplugs in your ear. It's about a 30% change in hearing or reduction in hearing. And they found that people with mild hearing loss were twice as likely to have that cognitive decline or accelerated dementia. But then when they go to those with severe hearing loss, so people with maybe about 60-70% hearing loss, those people had 5 times more of a chance compared to their normal hearing peers to develop cognition decline and dementia, which is huge. So they were finding that there was a relationship between hearing loss and dementia. So if you have hearing loss, you're more likely to develop that or cognitive decline. But not only that, there was a likelihood that as your hearing gets lower or worse, you have more of a chance of developing that. And they also found, or other studies that came out after that found, that when you correct hearing loss, so you bring it more to a more normal state, actually the chances kind of flip. So when you're proactive with treatment, we saw that that rate for cognitive decline and dementia actually started not being as severe. So that was super exciting for us as an industry as well, to see that, okay, there's this correlation, but there's something we can do about it. If we treat the hearing loss, we're seeing the impacts minimized. So that was really exciting. So that was the biggest thing, the research that kicked off this whole conversation about hearing and cognition in your brain. Hearing's interesting. We hear with our ears, we listen with our ears, but we hear with our brain. So our ears just collect the sound. Our brain is really what's funneling and processing and trying to make sense of that sound. So it's a lot of correlation, a lot of commonalities between these two processes that we never thought about before. So the biggest question we had after this research was why, right? Why are these people with hearing loss more likely to have dementia or cognitive decline? And the answer still 10 years later is we're not quite sure. We have some theories. So there are 3 things that we are looking at as an industry and profession on why this is happening. And they make a lot of sense to me, actually. But one of the big ones is, as you have hearing loss, your auditory center in your brain actually physically changes. And so the auditory center, which is right behind the ear, if you look at someone with more advanced hearing loss versus a normal hearing person, that center is actually going to have some atrophy because it hasn't been used. So the hearing center is like a muscle, guys. If you don't go to the gym for a year because of COVID, I think that's a lot of us, those muscles tend to go away and not know what to do when we have to work them, right? And we have to retrain them. And the same thing happens with the brain. It's a condition called auditory deprivation. So the longer someone goes without hearing normally, the harder it is for the brain to remember what to do with those sounds. This is one of the reasons that if you have a patient that waits 20 years until they have to have hearing aids because they really can't hear anything, they have a harder time doing well with hearing aids because it's been 20 years since that brain's been worked out. So it actually causes some physical changes to that auditory portion of the brain. So that's one of the theories. It's actually changing the brain structure in certain areas. So another theory, which makes a lot of sense to me, is something called brain overload. So whenever something changes in our body, our brain tries to figure out what can we do to help it and what other systems can I engage to make this better. The same thing happens when you have hearing loss. So as your ears go down, your eyes are working harder and your brain in general is thinking harder as well. And so when your hearing changes, whether people know it or not, they start reading lips and start taking a lot of visual information and engaging that occipital cortex back here and occipital lobe to help understand what they're hearing. So a lot of my patients are having a hard time right now with masks because if I do this, we lose all that context, we lose the speech information, gestures, smiling, we get all sorts of information from that when your ears go down. And so we're having to, instead of just using that auditory portion of the brain normally, we're now having to engage the visual portion of the brain, and we're also having to engage just general cognition because when you have hearing loss, it's not like you sit back and have a conversation. You are constantly having to think about what you're hearing. And so if it's muffled and you miss a word, your brain has to say, wait a minute, I didn't hear that. What did they say? What was the context? Does it rhyme with this? Does this make sense? And it's always playing this catch-up game when you're having a conversation. So you're having to think a lot more about what you're hearing rather than just sitting back and having a conversation and not even thinking at all about it. And so I have a lot of patients that after a full day of listening, whether that's school or meetings or or seminars, they're exhausted because their brain is working so much harder to hear the information because, again, it's not just hearing it, it's engaging other parts of the brain to try to interpret that message. And so that brain overload or brain fatigue is another reason that we think that condition might be correlated, because the brain's having to work a lot harder to hear and understand that message. So the third thing that we are theorizing, which is interesting, we're talking about this, is social isolation. So the hearing industry has been talking about this for years. The last 5 years especially, we've put a lot of attention on social isolation that hearing loss causes. A lot of my patients that have more severe loss that are not treated, when they come in, they say things like, well, you know, I don't go to church anymore because I can't hear the message, so why do I bother? Or when the family's all together, I just sit in the corner because it's too hard to hear and I just get frustrated, so why bother? Or why should I go to that party, right? And so they are starting to isolate themselves because of their hearing loss. Well, now with COVID, this is a topic that we are all talking about, is social isolation, especially in our seniors, and the impact that that's had over the last year. If you are sitting in the living room watching TV all day, your brain is not going to have the chance to work and process like it used to, versus if you went to the coffee shop to see your friends, or went to church, or went to meetings, or did all these other things. Your brain's exposed to so many other stimulus, and so it's working harder, right? Versus if we just sit still, the brain doesn't have to work, and the brain likes to work. It needs to work. It's kind of, again, a use it or lose it thing. So hearing loss does the same thing, you guys. If you are not able to hear, you are not going to put yourself in those situations that are more difficult to hear, because it's frustrating, because, you know, it's depressing. People just would rather stop going into those situations. And so then again, the brain is not working properly, which can lead to that cognitive decline and or increased likelihood of dementia. So those are the three things that we are thinking contribute to this. Now, here's what I want your takeaway to be. At the end of the day, I am not saying if you have hearing loss and don't get treated tomorrow, you're going to have dementia. So please, if you ever walk into a hearing office and you're hearing that message, stand up and walk out and find a good doctor. Now, there is a higher likelihood. So there are a lot of good things about being proactive with your hearing and treating it early, not just from a cognition standpoint, but from a medical standpoint and a social standpoint as well. But again, any of the fear-based marketing that says you have hearing loss, you're going to get dementia, please just be super careful of the facilities or the professionals that are putting that out there without explaining some more of the facts and the details about that. Now, that being said, again, there's a lot of proactive things or a lot of positive things about being proactive with treating your hearing loss. So as we talked about, the brain needs to have that information to start being able to remember how to hear well from the get-go. So as a provider, I would much rather treat you when you have a mild hearing loss versus someone that hasn't had that input for 20 years. It becomes so much harder to be successful with hearing aids. And again, knowing that there's that correlation as well, it is something important. It's changed our conversations we're having with patients a little, you know, rather than just saying, oh yeah, you have a hearing loss, and people say, oh, well, I can live with it. They can just talk louder. You know, there are some more medical things that people need to be aware of that hearing loss can cause. So we are starting to have more educated discussions about some of the consequences of hearing loss and some of the advantages to treating it early. So please be proactive with your hearing. And that just means even starting to check your hearing. We are so good with our eyes and our teeth. I would love by the end of my career that we add ears to that list too. We check our eyes and teeth once or twice a year. Let's check our our ears once a year. Most facilities, this is something that's covered once a year through insurance, or some places even do free hearing screenings so you can get a baseline and see where your hearing is before you have problems. And then we can counsel you and talk to you about some good strategies to protect your hearing and kind of preserve it for the long run. So definitely being proactive with your hearing is super important. And then the last thing I want to leave you guys with is know who you're working with. There are so many different professionals in our field, ranging from people without degrees to people with doctorate degrees, and a lot of different facilities you can go to. There are retail chains, there are big box stores, there's ear surgeons. I really advocate that a private practitioner and your doctors of audiology are going to be your best friends for your ears. We have a completely different approach that's patient-centered, that's educational, that's really revolving around what you need as a patient rather than a widget or a hearing aid or a technology. So definitely work a little hard, look at who you're working with, look at reviews on Google, Facebook, call them, find other people and who they've worked with, but find that professional that really cares about your hearing health and your hearing rehabilitation, not just selling something, especially from a fear-based marketing perspective. So anyways, I hope you guys enjoyed this. Feel free to leave any questions or comments in the comment section. I'll be circling back to this presentation. I'm going to do another one next month, and actually a follow-up on this one in a couple weeks that talks some more about some special considerations for hearing technology and those people with dementia or those patients with dementia. So some different technology upgrades, as well as things that we think about from a practitioner standpoint to help them be successful. So thank you again for the opportunity. I look forward to talking to you guys in a couple weeks. Take care.